Dentists tell us all the time how challenging it is for them to try and figure out which patients to treat and which ones could become disruptive in their practice. That's why they love our Case Selection Advice program. I'm Dr. Dan Gurman, founder and chief orthodontist of Orthobrain. After caring for nearly 30,000 patients in my clinical practice, I made it my mission to help dentists provide excellent orthodontic care for their patients and with confidence. Let's take a look at an example of case selection advice. These are the photographs that we use in order to provide an orthodontic screening report. We always begin diagnosing from the outside, meaning that we look at the face first. In this patient, you will notice that the teeth are covered because the patient is embarrassed about how poor the smile looks. Nevertheless, do your very best to capture a full smile. It is clear that she has a very large aesthetic problem. Teeth 8 and 9 are leaning back, and 7 and 10 appear to be too far forward. The upper occlusal photo clearly shows teeth 8 and 9 leaning to the lingual. This makes for a very predictable patient to treat with either braces or aligners. You may wonder why. After all, it looks so severe. In reality, as you push 8 and 9 to the labial, they will naturally help increase the entire arch perimeter, making more space so those teeth will predictably move forward. You will also note that there are very few rotations in this arch, rendering it very predictable for you to treat. In summary, 8 and 9 get moved to the labial, and the teeth will look very well aligned. The lower arch has a slight rotation on the lateral incisor. This will be very predictable to resolve because we'll be able to move the mesial part of that lower lateral incisor to the labial, making the tooth look ideal. From the buccal view, we can see that there is a really fine posterior occlusion. Looking at the anterior part of the occlusion, we can see that there is a mild deep bite. This appears very well suited for being corrected by improving the angulation of teeth 8 and 9. Many of our doctors review a hard copy version of the orthodontic screening with their patient. You'll notice that the practice has its own branding along with patient information. These are the photographs that dentists submit. We provide a picture of the appliances so the patient can see what they look like. We also have a picture of the retainers. There are some adjunctive services that the dentist can customize and display in this area. We have also provided a template that the dental team can complete with potential payment arrangements. Down below, we outline the main problems that we find in our review and describe why they are important to correct and the ideal time for initiating care. Page 2 of the orthodontic screening report is for your eyes only. This is for the dental team to review. Patient information is at the top. We review the broad clinical findings and goals you submitted and provide a predictability rating based on a 5-star system. So, in this patient, you can see that this is a very predictable patient to treat. Each one of the problems has a 4.5-star green rating. We also estimate the treatment time for dentists to share with the patient. This is a summary of the communications that have taken place between the submitting dental office and Orthobrain, the blue being messages sent by the dental office and the green being the response provided by Orthobrain. Thank you for learning with Orthobrain. Remember that you are invited to visit our website for free learning materials and for assistance in treating your orthodontic patients. I look forward to learning with you and supporting your practice again soon.